Hello there, everybody. Welcome to Ask Dr. Bob. And that is where you get to ask me, Dr. Bob Gabe, questions you have around diabetes. And so thanks for joining us again. My name is Bob Gabe. I am the Chief Scientific and Medical Officer here at the American Diabetes Association, and we do this monthly. Many of you are returning. If you're new, great. If you're returning, wonderful. Uh, if you have questions, just throw them in the chat. I've already gotten some questions in advance, so I'll start with those. But as questions come up to you, I'm glad to answer them. Um, this, by the way, is American Diabetes Month, the month of November. So you will be seeing and have been seeing a lot of stuff coming out from the American Diabetes Association. So around diabetes, lots of useful information and tips. So I encourage you to go to our website so that you can enjoy all that content and those important pieces of information. So, without further ado, let's get started. And I'm going to go to the first question here. And this is from someone that says, I just got diagnosed with diabetes. How do I go about finding a management plan? I don't know where to start. Well, it's a very good question. And, the first is sort of knowing what type of diabetes do you have? Is it type 1 or type 2? And usually your healthcare provider should be able to tell you that. Sometimes it's a little confusing and they may have to do some additional tests. Um, and I'll talk mostly about type 2 since that's 90% of people have type 2. So if you're just diagnosed with type 2 diabetes, um, you know, there the probably the most important thing is to arm yourself with information. Learn what you can because I can tell you from having cared for lots and lots of people with diabetes over my career, people that learn early on are able to do well and prevent bad things from happening. So, yes, bad things can happen, unfortunately, because of diabetes, but most of it, or a lot of times, we can prevent those things from happening. And so, learning early on what to do is the key. One of the questions I got was, what sort of tips do you have? How do I go about changing my behavior? Because at the end, a lot of managing diabetes has to do with what the person with diabetes does every day. Um, and whether that is taking their medication or monitoring their blood glucoses or thinking about what they eat or exercising, all of those things often require some change in the usual behavior. So, what do we know about changing behavior and what works? And so let me talk a little bit about that because there's a lot of science out there that understands what it is to change behavior and form habits. So let me share a little bit of that. The first thing is a few things to think about. One, don't try to change everything at once. I mean, you can. I'm not saying you shouldn't, but it's harder. It's easier to pick, one thing at a time. Pick one thing you're going to work on, and that could be something that you talk about with your healthcare provider. It could be I'm going to try to exercise more, or I'm going to try to eat healthier. Whatever that choice is, pick pick one thing. So start with one thing. Um, and the other thing that helps us when we're trying to change our habits is to have some peer support if possible. So tell people what that is. I'm going to try to exercise 3 times a week. Great, or I'm going to try to exercise more. Tell your friends and family that that's what you're planning on, and they can help to reinforce that. So uh, that's another tip that I would say. Uh, and then when you're setting that goal, be specific. So, saying I want to lose 10 pounds, that's great, but that's not so specific because it doesn't tell you what you need to do today. So be specific. I'm going to have less um, less sugary beverages. Uh, right now I drink this many, and I'm going to cut that back to this many. Be as specific as you can, because the more specific you are with the goal you're trying to achieve, the more likely you are to do it. Um, and then the other tip I will share, and this is true for lots of behavior change things, is track how you're doing. Uh, that monitoring really helps to reinforce the behavior you're trying to change. So, if it's exercising a certain amount of times, if it's eating a certain kind of meal plan, log what you're doing. It's okay if it doesn't go well every day. It never does. We're all human, but tracking that, it helps you to stay on goal. And if losing weight is part of it, weigh yourself regularly. Don't beat yourself up if you're not doing well, but weigh yourself so that you can see that progress, because it is reinforcing. Okay, so let's get to the next question. How many healthcare providers do I need to successfully manage my diabetes? Well, uh, the short answer is it all depends. So you want a primary person that's helping you to manage your blood glucoses. That could be your primary care doctor, your family doctor, or it could be an endocrinologist, a specialist in diabetes. Either one can work, and it sort of depends on how complicated things are. Uh, for someone that's really struggling and their diabetes is really complicated, well, then you might want to see a specialist. But most people with diabetes see a primary care doctor. In fact, 90% of people with diabetes see a primary care doc. So that's one person. They often will have a team in their office to help you, and so you want to sort of connect yourself with whoever are the other people that are part of your primary care provider. And that primary care provider could be a nurse practitioner, could be a physician assistant. There are many different flavors. Outside of that, it really is helpful, and we'll talk about this more, to meet with a dietitian, to meet with a certified diabetes educator, uh, or what we call now certified diabetes care and education specialist. Uh, those individuals have special knowledge to help guide you around diabetes and problem solve. So it's often very helpful to meet those people and have them part of your team. You'll also want to see an eye doctor on a regular, an eye provider on a yearly basis at least. And that could be anyone that is in your network, anyone that your provider suggests, but those are sort of the minimum. And then beyond that, it sort of depends what issues you might develop. People that develop kidney disease, well, then at a certain point, you want to see a kidney specialist. People that lose sensation in their feet and develop neuropathy, well, they may want to see a podiatrist. So it sort of depends on the other things going on. Uh, and the next question is a beautiful segue. Is mental health a big part of diabetes management? Yeah, that I like that question. So I'm going to broaden mental health to be behavioral health. So, not all of this is about having, for example, mental health issues that require medication treatment, depression, anxiety, those types of things certainly can happen in people with diabetes. And in fact, it happens a lot more than people without diabetes. Did you know what percent of people with diabetes you think have depression? 30%, almost a third. So it's quite high. Um, and many are not diagnosed. So that is something to be thinking about. But a behavioral health person, um, which is sometimes a similar name for mental health, they might be a little broader. They can help some of the coping that it takes of living with diabetes, because let's face it, it's not easy. And having someone on your side that you can talk to about the challenges you're having can be really, really helpful. At the American Diabetes Association, we think this is so important that we developed a special training program and certification program for mental health specialists that know mental health, but also know diabetes. And you can find that on our website to help you find the right person for you. Okay, so the next question here is my doctor told me that diabetes can impact my feet and that I should be checking my feet. But what am I checking for? Good question. Again, I love these questions. And thanks everybody for sending these in. And remember, if you have other questions now, you can throw them in the chat. And as we have time, we'll get to them. So what you're looking for on your feet are calluses. Uh, you're looking for redness, and then any areas of the foot where there's like a little bit of an ulcer. In other words, the skin is broken down and you can see some blood or something like that. That's really concerning. Um, that's something you need to let your healthcare provider know about so that they can do the right kind of treatment. And many times, if you catch it early, it can be taken care of and it's no longer an issue. But if you don't, these are the kinds of things that eventually could lead to an amputation. So check your feet every day, quick look. I've had people say, I'm a little bit large and not flexible, and I can't really see the bottom of my foot. No worries. Um, get a little hand mirror and hold that mirror to the bottom of your foot, and then look at the bottom of your feet. So that's another way you can look at that. Okay, we're moving right along here. And again, for those of you that are joining late, this is Ask Dr. Bob. I'm Dr. Bob Gabbay, the Chief Scientific Officer of the American Diabetes Association, and I'm here to answer your questions about diabetes. So here's the next one. Um, who do I talk to about my nutritional habits in order to make sure I'm eating the right foods? I'll tell you that this is one of the most common questions we get at the American Diabetes Association. We have a call in center, and that is one of the most common things. What can I eat? Well, uh, the best thing to do is to meet with a dietitian. They can really help walk you through what's right for you because one size doesn't fit all. Food's an important part of all of our lives. I know it's an important part of my life. And just being told, eat this, and this, that's probably not going to be something you could do long term. But somebody that can say, okay, what do you like? And now we know what's best for you. Let's come up with a meal plan that fits you, your tastes, your culture. That's the most effective. So think about seeing a dietitian. What are some just like general recommendations? Well, it's moving towards sort of the things that our moms and dads told us when we were young. Uh, eating more fruits and vegetables, particularly vegetables, fruit to a point. Lean meats and plant-based sources of protein in particular are healthy. Um, one big area is less added sugar. So you'd be surprised that if you start looking at the labels of foods, how much sugar is added to things that you don't even think are sweet. Uh, Ketchup, a lot of sugar. Uh, wouldn't think of it. Tomato sauce. Many times you look at the can, you'll see added sugar. So keep an eye out for added sugar and go towards less processed foods. Those are sort of really broad strokes. But another great resource is the American Diabetes Association website. If you look up our website, diabetes.org, you'll find lots of resources and in fact, something called a food hub that gives you a whole bunch of recipes of what to eat. We have cooking demonstrations, we have all sorts of information. So please take advantage of all of those free resources and keep in mind that in the end, the best thing would be to meet with a dietitian who can personalize things for you. Okay. So another question here is someone says, I know I need to get my A1C tested regularly. And for those of you that forgot, A1C is that 3 month average of your blood sugar. So this person says, I know I need to get my A1C tested regularly, but what are the other medical tests I need? Well, for starts, one should have at least yearly uh, cholesterol check. Certainly should have your blood pressure checked regularly whenever you see your provider, and a minimum once a year. Uh, and then blood and urine tests for kidney function to see how your kidneys are doing. And then the other two things that I will add is a yearly eye exam where they dilate your eyes and look into the back of your eyes. They put drops in, they look in the back of your eyes because many times you can have pretty bad eye disease and not even know it. And if you catch that eye disease early, it can be treated. And this day and age, we shouldn't have people losing their eyesight because of diabetes because we know so much of what to do. And then the last thing is what we talked about earlier: check your feet. Do that regularly. And when you see a healthcare provider, take off your socks and shoes so they can check your feet. Okay, moving right along. Is managing diabetes different for people with type 1 versus type 2? Yes, it often is very different. So some of the food and the exercise recommendations are similar, but the medications are very different. So let me just remind everyone of the difference between type 1 and type 2. So type 1 diabetes, which is about 10% of people in the US, I'm sorry, 10% of people with diabetes have type 1, is what we call an autoimmune disease. In other words, the body's immune system that normally fights infections and is really important attacks the cells that make insulin. It stops the ability to make insulin. It destroys a person's ability to make insulin. So as a result of that, uh, they over time don't make any insulin, and the only treatment for people with type 1 diabetes, in terms of medicine, is taking insulin. Now, what's type 2? Type 2 is what 90% of people with diabetes have, and it's two problems. Problem number one: people become resistant to the effects of insulin. The insulin their body makes doesn't work so well, it's not so effective. So that's problem one. What's the second problem? The second problem is normally when you become resistant to insulin, the body can make extra insulin, and it makes a lot of extra insulin. And if it makes enough extra insulin, blood sugars stay normal and everything's fine. Don't have diabetes. The second problem is when you can't make that extra insulin enough anymore. And so resistant to the effects of insulin and not able to make enough insulin. And so for people with type 2, they can be managed in a variety of different ways. They can take medicines, pills in many cases, that either help them make more insulin or make them more sensitive to the insulin they have. But over time, um, because make less and less insulin over time, eventually they often need to take insulin also. Okay, so that was a quick sort of overview of that. Let me see again. If you've got questions, throw them in. Let's see what we got here. So Yvonne asked, and excuse my head here, but I've got to read this small print here. So Yvonne asked, I'm struggling with 13 years of type 1, going on a phase of I don't care, and I can't be 100% on top of what I do. Any recommendations? Yes, Yvonne. Thanks for asking this, and I bet you, I know you're not the only one that has this. Sometimes we call this diabetes burnout. It's tough having diabetes day after day and managing diabetes. It's tough. And so, what do we do when we're burnt out? Well, this is where a behavioral health or mental health expert can really help. They can help talk through that burnout, get you feeling a little bit better about it. Diabetes educators are also great at talking through this. You know, it's hard. Sometimes it's tough. Maybe there are ways to simplify the medicines you're taking. There are lots of solutions, but the first step is raising your hand and saying, "Yep, I've got some burnout here, and I need some help." And getting that help is the path to getting back on track. So glad you asked that. The next question is Carol, and she says, "The doctor told me that my A1C shows that I have diabetes." And wrote a prescription, but never said anything about finger sticks. Should I be checking my blood? Yeah, I will say that uh, this is where I'll be careful what I say. But providers are very busy, clinicians are very busy, and they may not tell you everything you need to know the first time you're diagnosed. And so this is not uncommon. And so, is it helpful to check your blood glucose? Yeah, it is. Uh, Depending on what kind of treatment you're on, it will vary how often you need to test, but testing can do a few I'm sorry. Testing can do a few very helpful things. One, it allows you to learn uh, what the impact of what you do is on your blood glucoses. Uh, you'll be able to see things like if your blood glucose are high and you exercise, blood glucose tends to come down. uh, you can also see what different foods do. Different foods can have different influences on your blood glucose. So, generally, it's helpful to test. Um, how often depends a little bit on where you are in your diabetes journey, but it's something that you should feel free to bring up to your healthcare provider. So, that's another piece of maybe advice I'll share for everybody. You should always feel comfortable telling your healthcare provider what's on your mind and the questions that you have because they can't help you unless you ask them. And so please um, remember to do that. And what I tell a lot of my patients is before you're coming to see me, just jot down what questions you have because often those visits are busy and you may not remember it, so jot it down, make a little list of things that you want to ask about so that you don't forget them along the way. uh, so I think we're coming to the end of our time. I want to thank you all for joining. This is American Diabetes Month. Please tell your friends and loved ones about the American Diabetes Association and all of the services we offer. Go to our website. Let them know about Ask Dr. Bob. I will see you next month, and be well until then. All the best. Take care, everybody.